Hey guys, it's Emily, and it's been 6 weeks since my bilateral mastectomy with immediate reconstruction, and I thought I'd give you a quick update on how I'm doing so far. For those of you who are seeing me for the first time, I'm a breast cancer fighter and survivor. I was diagnosed with stage 2 invasive ductal carcinoma in October of 2021. It's now July 16th of 2022, and I have completed 16 rounds of chemo, and I will be having 2 more surgeries in probably September or October of this year. And that will be to exchange my chest expanders for implants, as well as have a hysterectomy. That is a preventative surgery because I did test positive for the BRCA2 mutation, which means I carry a gene that makes it very highly likely that I will develop ovarian cancer at some point down the road. So right now I'm still in the stages of my recovery for the bilateral mastectomy. And before I get into that, though, I do want to just call out how excited I am about my hair growth. Look at all this hair coming in. It's been 2.5 months since my last chemo infusion, and I was a little worried because my hair was just growing back all white only on the side. So it's now finally starting to grow up top, and I'm just super excited. I think my next vlog will be about the hair loss and the hair growth so far. But yeah, my body was just like, what do you want? Do you want hair length or do you want pigmentation? We can't do both. We were essentially poisoned for about 5.5 months. So, give us some time. So getting some hair back and not having to wear wigs as often is pretty exciting for me. So 6 weeks now since my surgery, and I'd have to say that the first 2 to 3 weeks for me personally were just rough. I think there were 2 occasions, one of those being right after I came home from the hospital, where I was sitting in bed in tears because, one, I was in pain. Thankfully, they do give you pain medication, but 2, I just was not able to I didn't have the arm strength to lift myself up and push myself further back on my pillows. I couldn't get comfortable. I needed a lot of help just doing little things like getting my clothes on and off, and having to get used to that restriction and that lack of mobility, when just the day prior before my surgery I could do anything with my arms: stretch, lift, move, exercise. So it was just tough managing the pain and the emotions, and trying to get through the days with all of the cords from the drains coming out of your arms, and carrying the 2 pain balls and these 2 sacks around your neck that got quite heavy, just being uncomfortable. And logically, you know that you've had a major surgery and that it is going to take time to recover and to heal, and for your body to get used to having these foreign objects, the chest expanders, in your chest. But you just really can't help wondering if this is how you're always going to feel. And so I had a couple of down days, but feeling a lot better now, much stronger, of course. It is still uncomfortable at times at night. I do still have to sleep in an upright position. And for me, chest expanders, you can definitely feel that there's a foreign object in your body. Mine have been placed under my muscle, and that is, I believe that's, from what I understand, it's to make the breast look more natural once you do have your implants. I still have my Metaport, which was where I received my chemo infusions. That's not going to be removed until probably beginning of next year, when everything is said and done. I'd never seen a chemo port ever before until my own. So if you see this, it's that someone has it on their chest. That's what it's for. More than likely they're undergoing chemo, so it's not a tumor. So I had to do another Arnie, of course. But yes, so week 6, feeling a lot stronger, able to move my arms a lot higher than I was initially before. I still can't have them completely straight up in the air or completely straight and up to the sides. But my range of motion is a lot better because, coming out of surgery, I think like this was my arm movement pretty much. I couldn't even extend my shoulders out and my arms out, and that was pretty tough. I was only able, I think, at like 3 weeks. This was as high as I could go. So that's great to be able to move more, reach things that are in higher locations, starting to exercise a little bit more, go on more walks. I still don't feel like I can go running quite yet. Hopefully by 8 weeks, that's something I'll be able to do because I miss that so much. Taking my dog on runs, early morning runs in the morning, it really did help boost my energy and just made me feel good. And it was really a bonding time for the two of us. I know he misses it too because he is a big German Shepherd and misses being active and having that exercise. I feel guilty at times that I'm not able to take him out and do more with him, but we'll get there. We'll get there hopefully. So with the chest expanders, they are like temporary implants. I was able to have mine filled 5 weeks after my surgery, and the way that works is there is a magnetic area on the chest expanders, and they use this little device that they move over your skin that will show them where that entry point is for the needle. And I thought that it would be like right in the middle of my breast, but instead it was actually further up. It was like right up in this area, and they mark it with a marker. I do have to warn you that needle is pretty long. It's about 2 inches long, and I kind of just had to look away. I'm not squeamish or anything when it comes to needles. I was used to it, getting the infusions through my port on a weekly basis, but they do put a numbing agent, a numbing cream over that your chest area where they're going to press the needle in. So you really don't feel it. I mean, you do feel the pressure of it going in, but I wouldn't say it was painful, just a little uncomfortable. And they do one at a time, and you can actually feel the expander being filled and feel your skin and your breast stretching slowly. The process itself is super quick. It takes longer to get everything set up than it does to actually fill them. I think in total it was about maybe 15 minutes, if that, but you could feel your skin stretching. And so this time around, I believe I got about 150, 175 cc's on each side. This expander, this breast is a little bit smaller than this side, and that's because I did have 3 lymph nodes removed under my right arm during my bilateral mastectomy, and they also filled my expanders during that time because I had the immediate reconstruction at the same time, and so my chest wasn't entirely flat. It was very uncomfortable right afterwards. My surgeon told me that I, was just to take pain medication and just take it very easy for the next couple of days. Immediately afterwards, I was very sore. I had to go back to work later that day, and just sitting and typing, like it just felt achy and heavy, and it lessened within the next 24 to 48 hours afterwards. I got my expanders filled on a Friday, but for some reason on Monday, and I don't know if it's maybe because I was just moving around too much or doing too much around the house or what have you, but I was really, really sore and it felt really painful on Monday. Right now, I don't actually feel anything. It feels perfectly fine, pretty natural. It's still very super tight at night. I do have moments where there's some shooting pains, especially on this side for some reason, which my tumor was in my right breast, but I do get a lot of tingling and numbness and tightness at times. I still have a hard time, like in the mornings when I go from like laying down to sitting up and pushing myself up and out of bed. It's still very tight around my rib cage, and it just feels like a pulling sensation. I try to keep lotion on my chest twice a day just to kind of help that skin. And one benefit though is I just wear sports bras usually, and that's pretty much 24 hours a day. The first 5 weeks, I did have to have my chest compressed with a long compression bandage, and then I'd wear a mastectomy bra over that to kind of keep it in place. And that was under the instruction of my surgeon, just to help keep the swelling down, to keep the chest expanders just taut and in place. And it was so uncomfortable though at night. Like I felt like I had a hard time breathing, even though it wasn't super, super tight. I guess when you lay down, your rib cage tends to expand more, and I just couldn't get comfortable with it. So at 5 weeks, when I came and got my chest expander filled, and I was able to remove that ace bandage, that wrapping, it was such a relief. And so now I can say that I do still have days that for some reason I'm still, experiencing that pain and that achiness. And I do often wonder at times, like, when am I ever just going to get back to normal? But I don't really know if there is such a thing as normal after you've had surgery for cancer. And I do realize that I just have to be patient with your body. All of those nerves are trying to regenerate. There is that foreign object, as I mentioned, under the muscle. So I will be getting my expanders filled a second time at the end of the month. I believe July 27th or 28th. It's the 16th now. And from there, we'll let them sit and settle for a couple of weeks, 2 to 3 weeks, and then I'll have them filled maybe a third or fourth time before I'll be ready to have the implant exchange. And so I'm pretty excited about that. I don't have to wear, or don't feel that I need my little gel cutlets to go into my bra anymore, to feel more feminine. I'm not Mrs. Doubtfire anymore, so that's pretty awesome. And I'd have to say that despite all of the tough times and the discomfort and the achiness and the pain, and my chest feeling like rocks, like I had a bunch of stones in them sometimes, and just the tingling, the numbness, the soreness and pain in my rib cage. Through all of that, I just had to remind myself that this is an investment for my body and for myself, and because I do want to have the full reconstruction and feel more like myself as much as possible at the end of everything. And so yeah, everything has gone well. I feel extremely fortunate. Lots of doctor's appointments, which unfortunately also make me feel guilty because I work full time and I'm having to flex my schedule to go to all of these appointments and see these team of doctors that I see, oncologists, 2 different surgeons, one who did my mastectomy, the other doing the reconstruction portion of my surgeries, and a gynecologist who's also a specialist in oncology, and then also my primary physician, as well as a dermatologist. So just a lot to juggle at times, but you get through it, and I feel very fortunate to have all of these professionals that are ensuring my well-being and my recovery. So I will just keep you guys up to date on the next steps and the process from here. If you're going through something similar, just sending you a lot of strength and encouragement, because I know that it's really tough. A lot of this journey is just as mental, if not more, as it is physical. But I feel as though, and Bear feels as though, if you can approach the situation with humility and honesty, it's going to just make you a much more braver person. And I think you can just help others face the same challenges in their life, whether it's big or small, with that same bravery and that same courage, and being able to help yourself and help others keep your spirit intact as much as possible, and be led by faith more than your emotions and more than your fears. So thank you so much for taking the time to watch this. I'm a little bit of a social weirdo, I guess, to some people. I don't use social media. I don't have TikTok, Instagram, Facebook, Twitter, or any of that. And so I don't really have a way of promoting my videos that much for others to see, but I'm just hoping that over the years it will get to the ears and eyes of those who it might help. I just really appreciate you watching. Please like and subscribe if you're new, so that will help the algorithm, if I can say that word, the algorithm for YouTube, and be able to be viewed more by others. So take care of yourself, and I'll talk to you soon.